Recording. Could you please mute everybody? Let me know whenever we want to start.
Fine. Start recording का बटन दबा दें आप.
Recording हो रहा है.
ठीक है. Now, yeah, I'm going to admit all and we
Mute
go
everyone.
ahead. Yeah. Fine. I'm muting all. You need to unmute yourself. Okay.
We'll start off now. Assalamu alaikum. A warm welcome to everyone.
No. Sorry.
Ji.
Just a second.
It's okay. We'll start off in a bit. Shall we start?
Yeah, I think we should wait maybe 1 minute, then we start. I think start now.
Assalamu alaikum. A warm welcome to everyone, including colleagues, friends in Pakistan and across the world who joined us live on this Zoom session, as well as everyone who's watching us on Facebook Live right now. I hope everyone is well. Today's session is being recorded while we're going live. So for data protection purposes, if you'd like to switch off your videos, you can. The session will also be available for everybody to watch later on YouTube, or if you'd want to refer it to for a friend to watch. I'd like to introduce myself. My name is Hira Arshad. I did my BDS from Fatma Jinnah Dental College, Pakistan, and I have been practicing dentistry in UK for quite a few years now. I will be the moderator for today's session. Now I'll be hosting two renowned speakers on behalf of the Impact team. Our first renowned speaker is Dr. Hussein Askari. Dr. Hussein did his BDS from Fatma Jinnah Dental College. He's done his master's in dental public health from UK. He also has a diploma in dental public health, and he's registered with the Royal College of Surgeons. He's worked with multiple NGOs, government department in Pakistan, UK, Canada. Currently, he's the head of department of dental public health, Fatma Jinnah Dental College. He's also become the CEO of Fatma Jinnah Dental College earlier this year. And it's worth mentioning that Dr. Hussein took over the most challenging role in the most challenging times, that's COVID-19 that's happened. I'm glad to inform everyone that Fatma Jinnah Dental College has not only gone through this transition successfully, but it's also established its reputation as having developed a very strong online teaching program. Assalamu alaikum, sir. If you could unmute yourself, please.
Walaikum salam. Thank you, Hira. Thank you for the kind words and the detailed introduction.
Of course, sir. How are you?
I'm good.
Good. Thank you so much. Thank you for joining us, sir. We'll come to your presentation in a bit.
Sure. Thank you.
You're welcome. Our next speaker is Dr. Ashar Jamil. He's done his BDS from Fatma Jinnah Dental College. His master's in clinical dentistry periodontology from Queen's Mary University, London. He's done his FCPS Part 2 postgraduate in operative dentistry from Khan University. He has 3 local, 3 international publications. He also has an internationally published book. He conducts various lectures and workshops nationally, internationally. He's currently the assistant professor, head of department of periodontology at Fatma Jinnah Dental College. Assalamu alaikum, sir. Dr. Ashar, if you could unmute yourself, please.
Assalamu alaikum. It's so nice to be here. Thank you for the great introduction.
Thank you. Thank you for coming, sir. We'll come to your presentation in a bit. I hope you're well.
I'm fine.
Good. If everybody could mute themselves. I will be hosting today's session on behalf of the Impact team. So I would like to introduce the Impact team. The Impact is a UK-based non-profit organization, and its mission is to build capacity for all frontline medical professionals. Now, currently, the world, unfortunately, is facing a pandemic, COVID-19. So the Impact team has conducted various lectures or topics considering the COVID-19's impact on them. And today's topic is one of them, challenges in dentistry in the era of COVID-19. Now, before I start off with the presentation, just a few guidelines that I'd like to discuss with everyone, please. The question and answer sessions will be at the end of the two speakers' presentations. Please leave your questions in the Zoom chat box on Facebook, and we'll try to address as many as we can. I'd also encourage, if you'd want to ask live questions on Zoom, we'd love to take them. Again, data confidentiality is of prime importance, so please do not disclose details of your patients. I hope everything is clear so far. Now, I would like to request humbly our first speaker, Dr. Hussein Askari, to please start off with your presentation, and I'd like everybody else to please mute your microphones.
So, thank you very much, Hira. Are we good to start?
Yes, please.
Okay. So today's talk, as you all know, is about leadership in the time of crisis. 7 lessons learned from coronavirus pandemic. The reason I chose this topic is because within the field of dentistry, we have leaders, and we have leaders who follow these leaders. So the head of an institution or an organization or a hospital or a clinic is a leader himself, but his team also, because they have a very responsible position, they are leaders within themselves also. So everyone leads a team, whether it's small or big. So the principles of leadership remain the same. As we're expecting a lot of dentists, faculty members and students of dentistry, and also this is open for other professions also, MBBS doctors, paramedics. I chose a common topic, and this is the one of the most challenging areas is how we should conduct ourselves during crisis. Many people are concerned about how they will manage the situation, how they will manage their team, how they will manage their patients. The key role or the key tactic here is to manage yourself first and manage yourself best. If you're able to manage yourself well, you will be able to manage the people who work for you, your team, your family, your friends, your students well as well. So that is why I chose this topic, because I've always had an interest in leadership. And during my education and being a faculty member and also part of the management of Fatma Jinnah Dental College, I had a deep interest in leadership and in people and how to manage people, because I felt that that is the key. One of the famous medical education experts, they have said that teaching and learning is overrated and management is key. So definitely in every aspect of our life, management is the key. And very recently, because of the COVID-19 situation, I was able to test out and hone my leadership skills, as well as my previous education, which is in public health. And public health has a lot of aspects of leadership, team building, psychology built into it. So I had a chance to test them out. And this presentation is sort of a summary of my several years of experience and studying leadership. And this is actually the 7 points that I've taken out are the ones that actually worked on a global level as well as our local in our local situation in Pakistan, especially in Karachi. And the principles of leadership can be applied to various situations. But these 7 points that I'm going to discuss today are the ones that I have tried, and I'm going to share my experience and how well it turned out, and the results which were expected. So as Dr. Hira has already mentioned, that I am the CEO of Fatima Jinnah Dental College. I joined Fatima Jinnah Dental College as a student. I did my BDS and my house job there. And very soon I was absorbed into the teaching, and I chose dental public health because it was one of the subjects that really encouraged me and it motivated me. And I was able to serve the people I always wanted to serve. And so continuing my education, I did go to London and to the Queen Mary University of London, and I did my MSc there. While I was working in UK, I also cleared the exams of the Royal College over there. On my return, I became the head of Department of Community Dentistry, and I've been doing that for almost over a decade now. And so some of the challenges. Okay, so now these are the challenges that have been shown on the screen. Let's go through it one by one. So the first is that state of shock. This is what people usually feel in crisis. When a crisis happens, people go into the state of shock. Ever-changing situations, incomplete information, not enough skill, equipment, or resources, inexperienced, untrained paramedics, or relief workers, or doctors, or it can go on. Fake news, rumors, and fear-mongering. Children afraid of going to school. Loss of jobs and livelihood. Overall gloom, depression, and anxiety. I'm sure most of us have experienced this in the last few months. But let me tell you, this has nothing to do with the COVID-19. These challenges were identified by school teachers after the earthquake in 2005 in Mansehra. So 80,000 people had died and 4 million people were left homeless. So going back to the slide, you can see the challenges are almost identical. So many years later, novel COVID-19, the challenges have remained the same, and this has been identified by the local community leaders, especially school teachers. This was a seminar where they addressed these challenges with the community, along with some of the international NGOs, where I was at that time the liaison officer. I was bringing together the community, the international NGOs, and the local government. So that was a role, a very small role for me to get these people together, people who had the know-how and the resources, and people who needed it the most. So these school teachers, they not only identified the challenges, they also suggested the solution. And this was a great learning experience for myself. The international NGOs which were working, and there was the trauma psychiatry team from University of Missouri. I've been working with them for almost 15 years now. They've worked in war zones like Bosnia, in Iraq. They've gone to various earthquake zones, and even in the US, the floods and the tornadoes. So they have that experience. So they had this idea of not telling people what to do, but to let them come up with their own solutions, how to deal with these challenges, because that is what is going to build self-reliance and how they will cope up with that. So the solutions that these school teachers, the mayor of Mansehra at that time, and the local leaders, which included religious leaders and social workers, they came up with these solutions. So they said, in the state of shock, we should not panic. If the situation is changing, ever changing, then we should plan stepwise. And then if the information is incomplete, we could reevaluate ourselves on a daily basis. If the people are not skilled, or the equipment or the resources is not enough, then we should still do whatever is possible. And they highlighted the importance of self-help. And they said we can do a lot of things on self-help basis. They also mentioned that whoever is stepping up at this time, volunteers, they should be appreciated. Even if they're not trained and if they're not experts, it doesn't matter. They are still heroes, because they are trying to do something which is within their limits, and they're coming out of their comfort zone, putting their lives at risk, and they are trying to help the situation. Interestingly, about fake news, rumors, and fears, and this was experienced during the earthquake. There were examples like people saying a baby was born who was talking, and he was saying, this is the sign of Qiyamah, the doomsday, and there will be 3 more disasters coming within the same year. So these were rumors, and the way they said that we will deal with these rumors and fake news is not to propagate them and not to circulate information which is coming through unofficial sources. So we experienced this at a great extent during the COVID-19. We've all seen videos of lions and tigers left loose in the streets of Russia. So those videos were not from the COVID-19. It was just fake. There were images of European cities flooded with currencies which had become redundant, and that was not related to COVID-19, and so on. There were so many messages coming on WhatsApp, and so many solutions, so many treatments, so many tricks, and we have all gone through all of them, and we have been guilty of forwarding every message to all our friends and family. But how much of that was helpful? I don't think a lot. But if there was information coming through official sources, they were most helpful. So there were thankfully some good information coming out, and people were stepping up who had the right kind of information and who put in the effort to bring out the correct information, and which changed timely. So we have to make these distinctions ourselves. Again, children afraid of going to school. During the earthquake, the school buildings had collapsed, their friends had died. Entire areas were flattened. So obviously there was no restriction from the government as such that schools will remain closed, but the situation was very similar. The kids were stuck at home, and we faced the same thing. And till today, we hear parents complaining what to do with these kids. They are at home, we don't know what to do with them. They have no outlet. And the suggestions that had come at that time in 2005 from the victims of the earthquake was just to provide a safe and comfortable environment to your children, because that was the most important thing at that time. Then obviously loss of jobs and livelihood. Again, this challenge is the same again. The only difference is that was an isolated community in Pakistan. This is a global phenomenon. But the solution is still valid. They said there should be reassurance. They said we all have the necessary skills. We have been working. Maybe this situation will pass. We will have to go through difficulties, but we will get our jobs back. We will survive. So that is the kind of resilience the people of northern Pakistan showed at that time, and that today we are seeing the same thing all over Pakistan. And then there was also the feeling that wealth lost is not the greatest loss, because so many people had died. And again, in this COVID-19, so many people have lost loved ones. So we can actually feel that, yes, loss of wealth and livelihood is very important, but it is not the same as losing people who are loved ones. And again, overall gloom, depression, and anxiety. This is what the victims of the earthquakes were feeling, and this is exactly what we were feeling during the lockdown. The suggestions that came from the school teachers and the community leaders in that small town of Mansehra was to take care of yourself and your family members. Be thankful and keep faith. So I wanted to share all these points so we can appreciate that in times of crisis, it may be the COVID-19 or the earthquake or flooding or anything XYZ, the way to deal with challenges, the wisdom there remains the same. We have to learn from these experiences. We cannot deal with one crisis and forget about it and move into another crisis as if this is the first time that we are facing a problem. We have to learn and keep educating ourselves step by step. This is the mayor of Mansehra, and that is me over there. I was part of the team who was conducting this workshop, which was a great learning experience. And I'm glad that I got a chance today to share that experience and the knowledge that I had gained. This is the team, some of the trainees from the trauma psychiatry team from University of Missouri who are working side by side. Now, coming back to the seven lessons that we learned. Even though all the crises are same, some of the features of this COVID-19 was unique, and it definitely taught us many lessons. And one of the key lessons here was staying relevant became very important. So the day when we went to our clinics, and then the lockdown was announced, and then the spreading of the COVID-19 virus and all over the news and getting lots of WhatsApp messages, this is happening, that is happening. We didn't know how to react. Actually, we did know how to react. We knew we have to keep ourselves up to date. We watched the news for most of our days. We stayed connected with our friends. We were getting messages on the phone. People who had to go back to their work and were supposed to lead their teams, they knew these are the things I will have to discuss with them. If we are closing down, or if we are changing protocols, or if I have to ask everyone to wear a mask or to sanitize their hands, I have to stay relevant. I have to say why I'm doing it. I have to say these are the guidelines from the government. These are the international guidelines. So as a role of a leader, we have to minimize the impact of the crisis, understand and evaluate changing priorities. Yes, the priorities kept changing. First day we were thinking about what will happen to our practice, how we will finish the curriculum, what will happen to the patients who come tomorrow. The next priority was, no, this is not the priority anymore. The priority is to stay safe, to keep myself safe, my family safe, and my team safe. Safety of the patients became a priority. So the priorities keep changing. Right now, the priority is to come back to normalcy, have normal working, have a normal life. People are returning back to their normal life. So the priority right now is becoming normal, but having all the SOPs in place and keeping safe at the same time. So the role of a crisis manager or a leader is to evaluate changing priorities and to move fast. address underlying concerns and engage fully. As a leader, it is important that you address the underlying concerns. You can't say we are doing this because this is what we have to do. In terms of crisis, you need your team to be on board and have a similar mission. You have to convince the people, you have to engage with them fully. For example, when I had meetings with the head of various departments, our meetings were long. They took like 4 to 5 hours just to decide things like how we are going to start our teaching programs online. So our strategy was that we will sit and we will discuss for as long as it takes until everyone is convinced. But once we go out of this room, we will be on the same page. It took a lot of effort, a lot of time, a lot of debating. It was emotional. But I knew deep down, this is something that we have to go through. Otherwise, there will be chaos. And it will be even difficult to address issues after they have manifested, rather than saying, I am foreseeing this problem, I'm foreseeing this problem. What problem are you foreseeing? If you are foreseeing a problem, talk it out right now. And that is how we all came on the same page, and we all became sort of leaders in our own capacities. And during this COVID-19, you've seen lots of videos of nurses being appreciated, people who are not at the higher management, but they became sort of an inspiration, sort of a leader in their own right. And they, following their examples, the image or the video of the nurse in China, how long it takes her to dress up, and the details that she has to make sure while she's putting on the personal protectives, went viral. And it was a message not only for nurses around the world, but also the doctors, the dentists, the leaders. Yes, in difficult times, you have to step up. Things may be difficult, but you have to face those challenges. So as a leader, and a relevant leader, effective leader, you have to address the difficult underlying concerns. You cannot run away from them. And you have to engage with your core team, and you have to engage fully. The next point is that you also have to remain visible. After the meeting, you cannot just vanish and wait and see what happens. You have to remain visible. Now, this word visible is a textbook word of leadership, but now it's so much more relevant, because visible could be through social media. I am visible to you through Zoom. So even if you're not there present physically, you can be visible to your team, you can be visible to your audience, and you can also be available. So these are the key points of staying relevant. And during this COVID-19 pandemic, it became so important to remain relevant. So like I've already mentioned, we had to go through local and international news on hourly basis. We had to see the geographical variations, what's happening in Karachi, what's happening in Punjab, what's happening in UK, what's happening in US, what strategies are they doing, why China is managing this better, and so on. We had to follow international and local guidelines. Some of these guidelines didn't match our circumstances, so we had to pick and choose. The guidelines kept changing, so we had to keep changing. We had to keep changing our policies. We had to analyze the political and economic implications of whatever actions we are taking. It's easy to close down an organization, but the salaries had to go. The people had to be paid even if they were sitting at home. So we had to see the implications. And then different strategies for different types of businesses. The strategies for the emergency ward was different than the strategies for the orthodontics department, for example. Dr. Ashar is here and he's listening. We were thinking, should perio continue with dental scalings? Even when the cases were reducing, we were saying maybe scaling is not an urgent treatment. And because of the aerosol, it is a huge challenge to disinfect and keep the environment clean. So different strategies were used for different departments, and we had to go really deep down on a micro level and to take these decisions. So having said all that, we had to be united, but we had to be honest about it. In various textbooks and research has shown that leaders have to be honest, but it is seldom practiced because research also shows that employees feel that information is kept hidden from them. The total information is not given out. But during the COVID-19, we had no other choice, to be honest. We had to go in and say, yesterday I told you this. Initially, we were doing testing, but that testing today is invalid. We have to go for the PCR. We had to tell them there are false negative, false positive. Even if you came positive, it could be this. Initially we were trying to screen everyone. Later on, we said no, screening is not possible. We will only test the people with symptoms. So because the situation was changing so rapidly and there was so much chaos and the international guidelines kept changing, we had to be totally honest with our team. We don't know what's happening. Even the experts don't know what's happening. They don't know what's the best way to deal with it. There was a time when we were wiping down our groceries and walking through sterilization tunnels. But later on, more evidence kept coming in and we said, okay, hand sterilization, mask, maintaining distance is the key. So things kept changing and we had to accept at every step the previous guideline or my notification to you was wrong. This is the correct one. Now we are going to do this. And to be honest, it worked out fine. People who are in leadership position, they think if I tell everything, then I will lose my position or I won't have a bargaining upper hand. However, this situation proved that you can be honest about it, have less stress, and still things can work out. Yes, transparency. If you want a dedicated team which is loyal and on the same mission as you, you have to be transparent in your dealings. And like I said, it turned out for the best. That's the only way we managed. We also had to accept division of authority. For example, we have various departments at Fatima Dental College. So the physiology department, they thought they are going to take the first online lectures. Actually, how we managed is remarkable. The day they announced that the institutions have to close down, one of the department, they took the initiative and they said that we are going to take the next lecture on Facebook Live because we already have a Facebook group and students keep sharing clinical pictures on this group. So we are going to take our first lecture. This is the next day of when we shut down our campuses. So they said, we will go with it. So now being in a leadership position, my previous strategies have been that I have to have a uniform system for all the departments. I can't say yes to one department and no to the other department for the same thing. Anyway, in this scenario, things changed. My authority had to be divided. I said, okay, if you are comfortable and you can start your lectures on Facebook Live, go ahead with it. Another department said, Zoom is much better. We don't have to register for it. We don't need this. We said, okay, you go ahead with Zoom. People made groups on WhatsApp. The previous way of conducting any organization or any educational institute is that we have to have a proper timetable. We have to know when the lectures are going to be, what time it's going to be conducted. A notification has to be signed by the principal. But in these circumstances, we were all on board and we said, okay, these are difficult times. We have to divide our authorities. We let individual department decide their own times. They took feedback from the students. There were lectures going on at 5 p.m. There was another subject, their lecture was going at 2 p.m. And we had no control over the timings, but we did make sure that we were monitoring these lectures. The quality of the lectures were ensured. Everything else was flexible. So that is how we managed to continue from on-campus education to online education seamlessly. There were no wastage of time, and we have been able to keep up to date with the curriculum. The campuses have recently opened up, but our second year course is complete, our third year course is complete. We did lose a lot of clinical work. The clinical hours could not be met. So now that we have opened up, we are sure that we've covered the theory part. So now the focus is on clinical. So the students are not going into the lecture halls for 2 hours, 3 hours, 4 hours. They are all in the clinics the whole day. So that is how we are coping up. So if I had not accepted that division of authority and the principal was not on board and the head of departments were not allowed to become leaders in their own capacity, then this all would not have been able to manage the way it was managed. And then encouraging positive accountability. Somehow, when we gave this freedom and the teachers, the head of departments, even the demos, they invited me, the principal, the vice principal into their WhatsApp group. So they wanted accountability. They wanted us to know how well they are managing the students. So there was the group had all of us, the leadership, one department head, their demos, and 80 students, 100 students in one WhatsApp group. And that was positive accountability. We were watching what's happening, but we were not controlling anything. Everything was going well, and we were just encouraging everything. And the people and the teachers were happy to have that kind of accountability. Point number 3, telling stories isn't for kids only. This has been a very recent tool added to a leadership toolkit. They're saying leaders, business leaders, entrepreneurs, health organizers, they have to tell stories. Telling stories is a way of engaging people emotionally, and including emotions into work gives you dedication and motivation. So even telling stories, sharing experiences, sharing other people's experiences, and what outcomes came out will create trust between the leader and his team. Yes, you are able to engage them emotionally when you're telling them a story. You can get support of stakeholders. For example, as a college, our patients are stakeholders, our suppliers are stakeholders, the parents of the students, they are stakeholders. So we were keeping them informed about what's happening. We made short WhatsApp videos, and we send them out telling them what we are facing, what's happening in our area. For example, like an unfortunate incident that took place was the medical superintendent of a general hospital, Azimtam General Hospital, died because of COVID. And that is a story we shared again and again to explain to people that we are going through a crisis ourselves. So you cannot come and just feel that you are the only person who has been affected by this problem. We are all going through a challenge, and whatever we are doing is in the best interest of everyone together. So this is how, by telling stories or communicating how we feel deep inside. The problem with management is we have to put up a strong face and we have to show that we are always in control. But during this COVID-19 crisis, this is where we realize that the textbooks about leadership, there are many things which don't work out practically. We have always seen leaders who are in control. We have never seen leaders who are out of control, and you have to sort of support them to remain in control, because it is important. People realize it's important to have a leader, someone who is in control, who can take decisions. Otherwise, it's going to be chaos. So telling these kind of stories made my life very easy. For example, we had people complaining that patients are calling us and they're saying for dental treatment, it's been 3 months and I've paid and I'm not getting my denture, I'm not getting my crown put in. So to manage, because now the doctor who's working in that department is frustrated because he has been passed on that frustration from the patient. And now I have to calm him down. I have to tell him that our policy is not wrong. So I have to reassure them. How I did it was communicating, and communicating honestly. I told them, yes, yesterday when I was coming to my office, I met a patient at the door and he was saying, why you guys are not opening the clinics yet? People are suffering. People are coming from various areas of Karachi, and they're waiting outside, but you are saying you haven't opened yet. So I had to tell them, no, see, the problem is that even we want to open. We have a lot of materials and equipment already ready inside, but we are not opening because we don't want to harm our patients. You tell me, if a person comes in to get a crown and 2 days later he's lying in an ICU somewhere with oxygen or ventilator, do you think that would be the right strategy? Do you think I will be able to forgive myself? That is when the patient understood, okay, the leadership has a point, but it is not just me telling them it's not our policy, we are following orders. No, I had to narrate the story to have them on my side so they could understand what I am going through emotionally and mentally and what challenges I'm facing. So when I narrated the story to one of my doctors, they were confident and they understood how to deal with the patient they were dealing with. So that is the power of telling stories. So quickly, I will tell you 2 stories, and these are perfect examples of leadership, how they managed similar challenges in 2 different ways, and the different ways they challenged it led to very different outcomes. The first story that I'm going to tell you is about defective tires made by the company Firestone, and they were used on Ford. Ford is one of the most famous, oldest automobile companies in the US. In August 2000, 6.5 million tires were defective. The wire inside of them, they were spreading with heat as the tires went on the road, heat was generated and the wires were coming out of the rubber. So there was a defect in the manufacturing of these tires, and it had led to 100 deaths within a month. So what happened here, that the Firestone company, they first send out information that people are not inflating their tires in the right way. So they put the blame on the consumers. When a week later it was established that's not the problem, then they put the blame on the Ford company that the wheel alignment was wrong. And then the Ford company sued the tire company. So as a leader, they tried to do away with the blame. They did not come forward. They did not engage with the people. They kept blaming each and other, and they were called into the Senate for a hearing. It did not end well for them. On the other hand, in 1982, the company making Tylenol, the capsules had cyanide in them, and a lot of people died. Here, the CEO, he took charge. He took some difficult steps. He came on TV and he said that all these Tylenol capsules will be removed from the market. So 31 million tablets were removed from the market. They were recalled. They did tests. They found out there's a serial killer who was opening these capsules and they are putting cyanide in it. It is something very locally that's happening. It wasn't their manufacturing process. Why this was a crisis and not just an incident, even though the problem was very local, it was a crisis because it was affecting the whole country, anyone who was using this medicine or anyone who was buying medicine. So it was a crisis. The definition of crisis is when you have to change the way you do normally, the way you conduct business normally. If you have to change that, then it is a crisis. If you just have to stop for a little bit and then you continue normally, it's not a crisis. What they did, they not only recalled all the capsules, they stopped making capsules. They started making tablets. They also came up with a packing which was temper resistant. That means if someone opens it and closes it again, people would know. That is why most of the medication these days, they come in packets which cannot be closed again. So this is how they managed the crisis. And within a few weeks, their business was back on track and they did not lose money. They actually gained more popularity because now their packaging was tamper-proof. So these are two stories that I narrated to you, and now you can understand how being available, being present, and engaging fully can lead to your success. Okay, this is an exciting one. Digitalizing is our new job. IT department. The role of IT department is changing. We know that once upon a time, we thought anything to do with digitalizing, online, we had to call the guy from the IT department, he would come and do it. If we wanted to make soft copy, we would send someone to scan it. But now things have changed. Doing that is our job. Even trends in technology is changing. For example, there was a time when these companies were investing in softwares for which you had to go and get training for a year or 2 years. For example, Photoshop, or these even Microsoft Office, Excel, they need training. However, now these companies are saying anyone with a Wi-Fi is our target audience. If you have a Wi-Fi connection, you should be able to use our software. So that is how the software industry is now seeing the future. So the future is for faster learners. It's not people with big IT budgets. It's people who can learn on the go. Today, I can send a message on Google Suite, which will be implemented tomorrow in the campuses. Gone are the days when I had to have a hard copy, a timetable, signed and stamped by competent authorities. Maybe we will continue to do it in the future, but it's not going to be for long. People are registering online. Everything is going online. So we have to become faster learners. The soft copy is becoming more popular, and very soon we will not be able to manage without a soft copy. So the steps of making some hard copies, signing it and converting into soft copies are going in the reverse order. Now we have to work straightly on soft copies. And we were all ready for this. We had the technology, we had the know-how. The lockdown just gave us a push in the right direction. And this doesn't need more explaining. Smartphones. Smartphones are lifesavers now. We do 80% of our work through smartphones. This presentations that you are seeing was designed on a smartphone, not on a laptop or a computer. So the role is changing. We don't go into books anymore. Google and YouTube are our new teachers. And talking about changing technology, in the last 6 months, no one has talked about Skype. Everyone talks about Zoom. Skype was the big thing. Only a few months ago, 8 months, 9 months ago, nobody knew Zoom. Everyone knew Skype. Today, Skype, no one is using, everyone is using Zoom. So fast learners and fast adapters are the people who will be better leaders in the future and people who will actually survive. In continuation, adaptability is the real strength. How fast you can adapt is your strength. New age leadership. So this could be a touchy topic, but after COVID, even the most seasoned leadership, even the most senior professor, even the head of any institution is not going to disagree with me. There was a time when the in charge of the company, the CEO, the head of the institution, the health minister had all the information. He was the strong man. He could face challenges. He could stand in front of anyone and shut them up. Because he had the information, he had the authority, information was coming to him and to him alone. Today, when the ministry takes out directives, three to four people are sending to you through WhatsApp. So that directive is not only for the inner circle. It gets disseminated to everyone. Even people who are not concerned can read the details of those directives and then they can question you. But this line says this, and then you have to deal with that. So leaders are no more leaders because of their post, because of their position, because of their knowledge. Why are they leaders now and how they will manage to be leaders in the future? If they are good influencers, if they are good innovators, if they can move fast, speed over precision. Like I said, I could have taken a 1-year course on learning how to do Skype the best way. I could have set up a corner in my house with Skype and everything. But today we are doing Zoom. So it's not precision. It's not perfecting one software. It is being fast, adapting quickly. Collaborations and networks. Leaders now have to collaborate with others. They have to have networks. They have to outsource things that they cannot do. So if there's someone available who can do something better, they have to outsource it rather than keeping everything under their nose. They cannot do that anymore. To be successful, especially if you are competing, there's a limit to how much you can achieve. But if you outsource things, you can achieve more. And then today's leader is comfortable in saying, oh, I don't have enough knowledge about this. This is not my expertise. They can bring in expertise from the field. They can bring in expertise from outside. They can have training sessions. So the role of the leader is changing and the skills that the leaders need are changing. Yesterday's playbook has to be thrown out. Now, people over processes. This is easy to explain. Now, people have become more important. Protocols, systems are less important. For example, I was explaining, running the institution had very strict protocols. We had timetables, we had circulars, we had everything. We had to do away with all of that. We focused on the people. We had to choose people who were going to deliver, people who we could trust, people who we knew would be on board, people who could actually manage things, irrespective of what their designation was. For example, the person who stands with a digital thermometer, his role is very easy. He just have to press a button and see what the temperature is. He has to make sure everyone is wearing a mask, right? What I could foresee was like, what if someone has fever? What is the person who's just standing there with a thermometer? Will he be able to manage the person who has fever? Will he tell him, oh my God, you have fever, you have corona, you have to go to the hospital right away? How would that person react? So the gate man, the watchman, the guard, that was the process. That's the first person who is at the gate. Right now, he is not the suitable person to do this. I had to ask someone from my administration to do that. And I had to go to him and explain to him, right? Previously, I would just ask the manager or the floor in charge to designate this to someone. But in this situation, every morning when I went in, he checked my temperature. I told him, if someone has temperature, don't worry. You are wearing mask. SOPs are in place. You are at a distance. You have your overalls. Ask him to sit in that corner that we have designated. Then call one of the doctors. They will come and deal with them. You don't start panicking, because if you will panic, the patient will panic. It will become a big chaos. So people became very important, and the process took a back step. I didn't go through my general manager. He didn't go through the floor in charge. He didn't go through the gate man. I had to do it directly and meet the person who was there at the gate, checking the temperature of each patient coming in, each student coming in. So that is how the people are now more important than the process. They were, but we were sort of caught up in the system. These changes, when there is an imminent danger, our body reacts differently, our decisions change. And that is what has happened. Now the most important things have become the most important things. People have become important. Processes, protocols are not what they used to be. So exactly what I've written here, normal condition versus urgent conditions, harmful conditions. You don't care for the protocol. If you see there's an emergency, you have to do CPR. If you are the closest person, you will do it. You won't call the head of medicine department to come in. So your decisions change. Similarly, if we learn from this experience, going ahead, we can focus on the people, and the protocols and the systems can take a back seat. It is going to take a back seat. Coming to unsung heroes, we have this tradition internationally to talk about unsung heroes because they stepped up and they saved the situation. But that's once in a year or once in a while, one person is being appreciated. The problem is in the leadership. Why were they not able to see that potential in that person? So it is your leadership skill to identify people with potentials. So they are actual heroes. They're not unsung heroes. They are important people in your team. They are the person you depend on. So the ways of identifying these people are by testing them under pressure. You give them a task which is beyond their scope and see how they behave. Maybe they can step up to the challenge. And then again, it is the nurturing and supportive environment that you have to provide. If you don't have a nurturing and supportive environment, then these important people who have the skills, who have the know-how will not step up. They will be afraid because of the system. Sometimes in meetings, you're having a discussion and you want to implement a policy, but everyone is fighting that policy. And you're trying to convince one person at a time. And there's someone in the corner who's quiet. And you are thankful because he's quiet, because you have to discuss this with one less person. You have to convince one less person because he's quiet. But I've tried this. I've given that person a chance to speak. And you know what? He was my best ally. He agreed with me. He had the evidence that I was right. He was quiet because he didn't have to speak. He was comfortable in his own shoes. When I gave him a chance to speak, the meeting went in another direction. He was my strongest supporter, but he was quiet. So I, as a leader, have to realize I have to speak last. I have to listen to everyone, even the person who's shy, even the person who's quiet. I have to give him a chance and see whether he steps up or not, whether he is able to take up the challenge or not. People behave differently in normal days. They behave differently when they're faced with a challenge. So we have to make people's work a bit challenging, and we have to sort of appeal to their emotions and to bring them to their highest potential. 7 and last, this might seem intuitive, but I will promise you it is not. The topic is wellness is a skill. We are used to dividing people into healthy people and sick people. Sick people can be well, and healthy people can be unwell. This might be a slightly difficult concept, but someone who has diabetes, but he is maintaining it, he walks every day, he goes to work, he is well. Another person who has no sickness, all his blood reports come fine, but he can't sleep at night, he gets up tired, he is not well, right? So we have to come out of our medical diagnosis and we have to evaluate person on their wellness, their mental state, their physical state, their ability to perform their duties and to socialize with people. If someone who has his blood work is perfect and he has excellent blood pressure, but he doesn't have a social life, is he actually well? These are the questions that we have to ask. And why I'm saying wellness is a skill. Wellness is a skill because there was a time when the environment was conducive. Conditions were better. A normal person was normally well. Nowadays, we have to put in the effort. Yes, we find the closest parking to our office and we take the elevators wherever possible, but then we spend 1 hour at the gym on the treadmill. So to being healthy, we have to understand that now effort has to be put in because our lifestyle, the normal conditions are not conducive to health. We have to learn these skills. Coming to nutrition, nutrition has become so confusing. Initially, it was the fat that was the problem. Then it became sugar. So people started from preferring low-fat diets. Then people said, no, fat is not the problem, sugar is the problem. That is when they started taking sweeteners. Now we all know that sweeteners have carcinogens. So we are back to sugar. And then recently an article came that says there's no bad cholesterol or good cholesterol. Cholesterol is good. It's in your brain. It's in your neuroplasticity. So cholesterol is not bad anymore. This is the recent research. So this takes work. We need to know what's good, what's bad. We need to, anything that is presented to us and looks good, it's not good to eat. And then with stress and isolation during the COVID, we had to work on isolation. We had to decide, am I happy reading and forwarding all the messages that I got on WhatsApp, or should I call one of my friends and have heart-to-heart discussion, because that's what I actually need. I don't need 1,000 likes on my Facebook. So these are things that actually people felt. And for the first time, I had my students tell me, we got sick with social media, so I haven't seen my social media in 4 days. This is not rocket science. We all know social media adds to stress and mental problems, but it had to have this COVID challenge for people to actually take action and to realize, no, we cannot be listening to these messages and the statistics of people dying every day. They said, no, we have to stop it. They closed their watching news on daily basis, and they said, no, we have to spend time with our family. Since we are in this lockdown, let's make the best of our time. Doctors and physicians all over the world, they were suggesting art and music. So it's not that we don't know the importance of art or music or poetry. We knew the importance, but we were lost in the system. This lockdown showed us that no, we can still have a very busy life and still decide what is important for our mental health. All of us learned the skill to engage our kids and to have happy conversations with them because they were bored at home. Even online education, kids and teenagers sitting in front of a screen for hours after hours, we knew it's not good for them. We gave them time. We read them stories. So we put in the effort. That is the skill that we have learned during this crisis, the skill of keeping us mentally sane. And even in isolation, how to have well-being. Even though the gyms were closed and the parks were closed, some of us put in the effort to stay fit. We knew we had to get out of our bed, even though we don't have to go anywhere. We brushed our teeth, even though we were not going to work. So these were the things that we have learned through this crisis. And I would appeal to everyone not to forget these things. They should carry on. Uh, our life will become busy, it will become hectic, but it will not have the same challenges as the lockdown. So if you can do all these during the lockdown in gloom, when people are dying, your family members are getting sick, your friends and relatives are in hospitals, you are still able to take out time for the finer things in life and enjoy your time with your family, you can continue to do this on a regular basis. And this will help you take the right decisions at work to stay grounded. And if anyone has a underlying mental health condition, if you're prone to depression, if you're prone to anxiety, if you're prone to stress, this becomes more important for you. You have to learn the skills to manage these things. So that was a long lecture, but I've come to the conclusion finally. Let's go through all these points because these are the summary of my experiences during the last 8-9 months, what worked, what did not work, everything that I had studied about health planning, about human psychology, about trauma psychology, about health systems, and the experience of me watching and learning from people who are twice my age, who've been in leadership position for ages, when they were successful, when they had setbacks. So I will just quickly go through this again. So first point was staying relevant, and it needs effort. You have to put in the effort. Unity comes with honesty. Honesty is the best policy. I never use this cliche because it means nothing to anyone. But after today, I'm sure it will mean something to you. Telling stories isn't for kids. This is also a skill. Learn how to explain yourselves with examples, with short stories. This will not only build trust, it will also bring your team closer to you. Digitalizing, yes, there's no getting away. You have to learn these softwares. You have to have command over these softwares, the technology, and you have to become a fast learner. Uh, doesn't need a lot of effort because you will be doing it anyhow. Just stop thinking of it as a problem and think of it as a strength. Adaptability is the real strength. Yes, you have to be flexible. You have to be adaptive. Uh, those days are gone when one person who was the strongest, the most overpowering, who had all the knowledge, used to be leaders. These people will not survive any longer if they are not flexible, adaptive, and even agile at the same time. Your people, putting people first. People are important, their skills are important. You get things done through people. Processes and systems are there, but they are not the key. The key is to get the task done. And it's the person who gets the task done. It's not the system. And lastly, wellness is a skill. So these are the 7 points that I wanted to discuss. And I hope you will all find time and ways of practicing this in your daily life. Thank you very
Thank you.
much.
Thank you, Dr. Hussain. That was a wonderful presentation. I will tell all our colleagues who've just joined in, please leave your questions in the chat box, Zoom chat box, or on Facebook Live, and we'll try to get back to them as soon as we can. We will just switch off this presentation. Our next presentation is by Dr. Ashar Jamil. I'll request him to please start off. Dr. Ashar, you would have to unmute yourself, please. And we're starting. I think, Dr. Ashar, you'd have to unmute yourself, please.
Okay, can everybody see my screen?
Yes, we can see your screen and we can hear you
And you
now.
can hear me. Okay. Assalamu alaikum. Thank you for that very enlightening lecture. And now I would like to continue the same because it's all about awareness, and we need to move forward somehow because we are in a crisis, and these things are something which we are facing every day. And so I would like to talk a little bit about uh, I am assistant professor, head of department, and as I think I have had a very good introduction already. So this is before I was at Fatma Jinnah, and that's where my undergraduate yeah, and everything started. And all these leadership skills are trusted and brought upon us from the start, from our teachers like Dr. Tasneem and all that, which has brought us to where we slowly started to inculcate and bring ourselves forward. So with that acumen and knowledge, I joined the AKU for operative FCPS training. I did my training there. Once my training was done, there were these very dark areas which I had. We always used to talk about periodontology in so since most of everybody is our dentists and have joined us, I'm very grateful and to the Impact team, and good morning to everybody as well. Whoever, if it's morning, it's nearly noon over here. So people in the US and everywhere. So what happened was I started to pursue my training at AKU, and then because of the lack of knowledge, I had to pursue something further because I always had something about periodontology, which always used to be there in operative. So that I wanted to, and I never really got answers from anybody. I tried a lot of avenues, and so I decided that in Islam, if you have to go and if you have to go to China or to acquire any sort of knowledge, I would do that. And that's exactly what brought me from my training. After finishing my training and finishing all the requirements of AKU and my operative dentistry, I decided that I would go to the #1 university, which was #1 at that point of time, Queen Mary. And Dr. Hussain is also part of that. So he would also know that we also, whichever, it was one of those great experiences which we had. And so I would before that, so this is where I led back. I came back, and I was called by Dr. Hussain's father when I joined in. Sir had said that I'm an endangered species. There aren't many people here who have done periodontology, and it was a big honor. And I've been working ever since at Fatma Jinnah as head of department. And these are the kind of things. So I'm just going to kind of give a few cases which I had done. So I will slowly move to the where I'm supposed to go, the matter at hand. But I just thought that maybe I can try to ignite more flame, because we need to have more specialists in this field, because people, even for that matter, I didn't know about this field too much. And it was an enlightening experience. It was a complete uh, I got a great amount of acumen of knowledge when I did go there, and I realized that it was something which it's good that I wasn't complacent, and I decided to venture out, and it was a great experience for me. So these are the kind of things which we do. This patient came to Fatma Jinnah, and she had a problem breathing and eating, and she was very distressed and in a lot of problem. And unfortunately, it was something which, these are some. It's a sad. It was a very sad issue that we thought that, okay, she's going through so much. So so this is the kind of work I do. I started off, and again, so this is a few more that you can tell how gravely it had affected her. And so this is my treatment which started, and I had to remove all those chunks and and if you would believe, there were actual huge chunks of gum, the size of ping pong balls, which was blocking her airway. And that even had to be removed in order for her to get back to normal. And we had to go through like tests and everything to see that if it isn't anything sinister, any malignancy, and thank God it wasn't. Then we carried on and we moved on. And this is later on. Unfortunately, she had a lot of gum bone loss. So that was one sad thing. But I had to get her quality of living fine. I had to make sure that she's breathing and eating properly. So this was what later on, after all the treatment, we had this result. And so I mean, these are things which I as a practitioner, I do work, and God has been kind that, and it is, I do all the work, but God does the healing. And I'm very glad that this turned out to be very good, because she comes, and whenever she meets me, she gives a smile. Before, she didn't give that. And this is also cosmetics as well. If there's melanin, person who smokes and this and that. So this is another part of things which we need to look into. And this is what I have done as well. This can be done. We also use lasers, or also otherwise. So this is something which I have, and I do as a routine. And sometimes if I have to regenerate, so I bring back bone. So we do a little bit of magic that way. And again, as I said, I do all the procedures. All of that is done, but God does the healing. So I do this, I do the surgery, and at the end, I get my bone and I get everything. And God has been very kind that everything has been doing quite well. Sometimes if I have to, if there's a recession, there's sometimes you want to try to bring back and see that if we can remove that, if they have symptoms which are there, for example, sensitivity, or if there is any other like an aesthetic issue, so then you can place a connective tissue graft, and you can coronally advance or use a tunnel technique, which is done here. And so these are just some of the things which we do. And other than that, again, if there's some people who are there who are aesthetically, again, as I said, that some people, this patient could not smile. She said that I did not like my smile for the longest time. And I'm very embarrassed, and I feel that socially it's a big stress for me. And I'm very, very, I feel very uneasy. So again, this is her afterwards. It was something which this is something which I really stress on. And God has been kind that way, that it worked out well for her. So this is the normal. This is now all these surgeries and everything what I'm doing has taken a turn. And because you see, we have to make sure as Dr. Hussain also said, that we have to make sure that we are safe and our patient is also safe, because we cannot have that we harm our patient in any way, because that is something which is our concern, and also that we also don't get harmed as well at the same time. So this is the normal, this is me in my practice in the evening, and I have to be completely geared up like this because we cannot take any chances. So these PPEs is also there in the morning where I work at Patpajana, as I'm also taking care of that. We have to have the utmost protection. We have to make sure that because it's all about, we have to make sure that we do not have anybody who has any harm in any way. At the same time, we also need to make sure that that the treatment is done, and in a way that because what infection protocol is that you have to treat every patient as a carrier. So if you have that in mind, that is half of the battle. You need to make sure that if that patient has AIDS, HIV, or hepatitis, all of these are things which we encounter. And now the new this thing which has really engulfed us and has put us in a very big dilemma. And this is something, because of that, we have to get to these measures. We have to make sure that we are completely equipped. And unfortunately, it comes at a cost, it comes at a price, because all of these things are not as they turn out to be. If you have these sort of equipment which is which is disposable, it can turn into quite a sum, because then you have to keep investing in it. So if you can find autoclavable, and even this mask which I have is a 3003M. So this one is also very expensive in the sense that you have to change the filters, and for the kind of work I do has to do a lot with the ultrasonic. And when the ultrasonic comes into play, and any handpiece or any of that gives the risks of aerosols, and you can have all sorts of things which can cause problems that way. And because you would have aerosols which can travel, and that has bacteria, and this is the whole idea, is to make sure that we are safe, and we hopefully are also also protecting the patient as well. And so we are finding all sorts of ways. There are all sorts of new um, novel ways which we always have to keep brainstorming, and we need to have an insight, and we have to keep ourselves ahead to make sure that we find newer concepts and newer ways, so we can really make it easy for us. Because as well, at the same time, if you're seeing I'm layered up like this, and it can also be, as far as it can also be a really if you do not have a proper air condition, it really becomes difficult. And sometimes some patients might even ridicule you, saying that, okay, it's a Halloween costume which has come up from, and is that it's coming up, so maybe can you please come to our party. But you have to ignore all those things, because this is about safety. This is about bringing everything, that we have to make sure that the patient is safe and we are safe, and this is something which has to be implemented, and cannot be stressed. uh, uh, I can go on and say this again and again, but this is something which is a very important part of our clinic, and it is part of it now. We don't know how long it's going to stay. So unfortunately, that is reality, and we have to face reality the way it is. So these are the posters which we need to which we have placed all over, even in the morning Fatmajana, and even uh, in our practices in the evening. We have to make sure that we have enforced everything again and again. These things are probably ad nauseum. They've been repeated again and again, but we have to do this. This is something because people forget, and there are chances that there could be a second wave, which and I think a lot of the world is facing a little bit of that. So this thing has come into our life, and we need to make sure that we do not let our guard down, because a lot of people are doing that, and it's a simple procedure. Why can't we just wear a mask when we are supposed to? We People I have seen are misusing and not doing that. This is part of you now. You must, no matter what. That is just the first basic, and if you do not follow that, it is a pity, and we will all suffer. And if you're not staying at home, uh, that is something. But these are simple things. You must make sure everything is in order. Try to keep a distance, because this is the normal. you know Etiquettes as well, that you're covering and you're coughing. You need to make sure that that etiquette is in the clinic as well. This it is more important in the clinic that you do not sneeze, or you have to make sure it's in a tissue, and not and you have to make sure that it's disposed well, and touching your face and mouth again, and then disinfecting the area. So this is, especially in the clinic, these things are something which we really need to look into. And even in especially with a bigger setup, where the clinics have a lot of like, for example, in Fatma Jinnah, we have brought in new ways, and we have to, because the setup is quite huge. We have to make sure that we have a lot of distance between each chair, to make sure, because to make it go smooth, and lesser patients, appointment patients. So this is how our normal has started, and this is how it is here to stay. So we are making sure that we are enforcing it, and there's checks and balances at every end and every step of the way. So the nowadays there's a weather change which is probably taking place. So you can have fever and the common flu, which can also be coming up. So we must know and differentiate between that. But these are some of the things which we dry cough, and these are some things which we always have to look out for. And this loss of taste and smell, vomiting, and all of these muscles. So we must know our thing, our whole uh, uh, the symptoms, and isolate ourselves whenever we can. If we feel that there, because if it is the common cold, then that is a separate issue, or fever because of the flu. Again, the etiquette and everything is something which you keep on putting posters up. WHO has all these specific things to educate the masses, because now it's not about it's a global phenomenon. Everybody is in this, especially in Pakistan as well. We are also part of it. So even translating it and to bring more awareness is the key, and to keep on spreading and keep on insisting and keep on talking about it is what the order of the day is. And this is when we always have, we need to do this at the start. And this is how it starts off. You try to make sure that less visitors come in, because less people are entering your clinic. And these basic setup, disinfecting with sanitizers, before entering the clinic as well. This is part of the norm, and good spacing. Emergencies are the ones which are being seen, and this is part of what it is the normal, and we are going ahead with it. Now, this is something which this is again, I would stress upon Islam. If we have to bring about and when we associate, we have to put both together to realize how important this is. We follow one of the best religions, and so we should also put that into practice. When you're putting it into practice, that means half of your faith is cleanliness. You must make sure that, and there's a particular way in the clinic, you must make sure that you have learned this. Unfortunately, we're still in the process over here of educating the proper way of doing it. In the UK, I found that it was more commonly used, and I'm sure Dr. Hira is also must be following all this. But we are now slowly warming up to this, and we know that because of the instructions, we have placed it everywhere in every workplace, in every wherever we are, to make sure that, so this is a simple way. It should take, if you can do from 30 seconds to 1 minute, you need to follow the exact way how you do it. And these instructions have been placed everywhere. They can be found very easily on the internet. You need to place it next to every wash basin before any procedure, and before anything, it has to be placed, so you are following this protocol, so you know that you are enforcing that you do not have any sort of bacteria or anything which would be there, and this should be done. So now moving on, so these are things where we need, as again the normal has come upon, that we need to have perform procedures in a negative pressure room. So this is like where you have, so I will be using this acronym again, airborne infection isolation room. So we need to have that, and that is especially for aerosol generating. So as before, we are using N95 or N99, or the sort of the mask which I was showing you. But this is also an important thing where you need to have this specific sort of pressure room, negative pressure, and this stops the especially for ultrasonic or handpieces, which is a big part of it. So if we are using it, this is something which has to be enforced.
Dr. Ashish, sorry to interrupt you. For some reason, the screen is not showing up properly. I think you need to stop and start again the screen, then it might come up properly, because there's one bar coming up.
Is it okay now?
No, it's still, there are bars coming up since beginning. So now basically text is there, so we can't see the text. So I think the best approach would be you stop the screen and share again. That might help.
Is it okay now?
No. Yeah, it's okay now.
Okay. So this is how as I spoke about, carrying on with the guidelines. So you have to consider taking extraoral radiographs instead of intraoral. So because you can have gag reflexes, again, that can cause a way of having aerosols and things, because it is respiratory. So you can have from the respiratory while breathing, you can have this to come and spread. And then limit the number of dental healthcare providers. So you need to have just the assistant and you, essential for patient care. So you are making sure, and plus the assistant has to be wearing the same, whatever you're wearing. There's a face shield, there is the proper PPE. So you have gloves, and the disposable, and even like now it is the mask, and then you have to have proper eye protection. And as they have also spoken about with the literature has spoken, they were talking first in the beginning because information keeps changing. They were saying that it can be spread from the soles of the feet, but now they're saying that no, it is that is still under. They need to have more studies. They even had this new tunnel which was there where you had sprinklers and sanitizers like alcohol, which was being spread on. And that was again something which people thought that would help, but that did not. So these, there's a lot of things where things are changing the norm. So we keep evolving with research, and we keep finding new ways and new means of how we can try to ensure. And if we need to make sure that we are covering our shoes as well, so there are protection for that, because we don't want to take any chances, because when we go home, we just leave those shoes outside because it could be there for some time. So you have to make sure that, and then you get that cleaned and after a few days to make sure that, so these are things which are essential, and we have to work on those. As I spoke about, high evaluation suction, rubber dams to minimize the droplet splatter and aerosol generation. So these are some things which we already, rubber dams are very important with root canals, but now they are even extremely more important as well, where we need to work and have to make sure that we're using these. And now when we spoke about ultrasonic instruments, so this I use it because uh, we were first deferring a lot of patients, and rightfully so, because we wanted to make sure. So this was even in the evening clinic and in the morning, we were making sure that things get a bit more normal because of the aerosols which can start generating. But if we are using the proper the masks and the proper PPEs, especially the mask which I'm wearing, which I feel that these are things which now we slowly have to, because as the cases start to get less, so we had just recently started in our at Fatma Jinnah as well, and so because hand instruments was something which I have always used. Gracie curettes are and universal curettes are something which I have used, and I feel that these are a panacea, and they help a lot for me in every procedure. And this is something which I, as a periodontist, and I think everybody else agrees, helps me in an ample amount of way. So I am using more of that, and that is where we are doing that. Again, we are in close proximity, and we could be, and that is where, you know, things and challenges keep on arising, and that's why we must make sure that we are enforced in every way. Endodontics, this is something which, again, I have been trained as well in endodontics when I was an operative. So you have to perform endodontic procedures with dilute solutions of sodium hypochlorite to extend supplies without adverse effect on outcomes. Use resorbable sutures. So whichever surgery I do, I make sure, you know, so you can, so then the patient does not come back, because you do not want unnecessary visits. You want to minimize, if you have to, whichever surgery you're doing, or an implant or any other surgeries, they all have to be minimized as much as possible, because do not want people to come and unnecessarily. So disinfect in surfaces. So whatever we're disinfecting, we are using alcohol, which is 50% and above. So this is where we have to make sure that they are particularly, you know, that they have the efficient way of wiping, and all the surfaces are clean and things are in a way we make sure that we can use and have a proper environment where, again, because whatever we're using, we need to make sure that all the usage is completely done properly. Um, wear an N95 equivalent or high level respirator. So I had spoke about this: disposable filtering face respirator, powered air purifying respirator, or elastomatic respirator, eye protection. And these are all some things which we must and remember this, that these are some things which are life-saving, and we have to do this using the infection protocol. Using a negative, so I did say that I was going to come back to this acronym. So using a negative pressure room may create challenges, as most, not all have dental offices lack. And so larger organizations may have dental operatories that cluster in open surfaces without physical barriers. So you can have a portable. So this, the thing which we're talking about, to have a negative pressure room, there's a HEPA air filtration which can work out. So they are not, they're not in every operatory, but they're portable ones which can be used. And that portable thing is something which can cause, so that is a purification and filtration unit. It's common standards requires that a HEPA filter must, so it has at least 99, 95 or 90 of particles diameter is filtered with this. So this is what it is. It is, we need to start using these. It is used and it is being placed, and that's how we go forward with it. Also consider the use of upper room ultraviolet germicidal irradiation as an adjunct to high ventilation and air cleaning rates. So again, this is a part of the thing which we have to do when you have to take on board the receptionist, you have to take on board everybody who will do a pointing. It's necessary that even if necessary, you can have the dentist or your can message and find out, or email to show that if there is any, or has the patient traveled, so you have an assessment before, and you can know if there is some sort of thing which is corona related. Then you can defer it for a little while, and you can try to see if you can do something on a telephone or a WhatsApp. You can have a sort of a appointment there where you are observing, and you can see if it accordingly, if they have symptoms of this sort, then you can try to tide away emergencies via medicating, and then they can quarantine and make sure, get themselves tested, and then later on we can move on. So a lot of things can with the telephonic or WhatsApp, because you have a video, you can always try to find symptoms and try to figure out, and then later when they get better, then you can use the same you can use equipment and make sure that you are safe and you are checking and doing things like that. So this is part of it. Expanding in-office registration process to screen out patients with symptoms consistent, so, or who have been exposed to recently tested. So you have to screen out, as I had spoken about before. Checking temperature again. So you're using all sorts of ways of, so this alcohol, which you have 50% and above, this is something where you have to make sure that you've wiped the pens, the clipboards, counters, keyboards. So these are the things which are you using all the time. So these are things which you need to make sure that you are on board, and you've made sure that you have ensured that this is done, and then you go ahead with whatever work you have to do. But this is something as a routine. Extending time between patients. So this is also a very important one. Have to make sure that you are disinfecting it properly, and decontamination of the examination rooms. That is done afterwards. Maybe you have fumigation at the end, which again, it becomes a bit of a costly affair, but we have been doing that in various clinics where I'm working as well in the evening, and also even at Fatma Jinnah. So this is something which again we are stressing upon, that we prevention and making sure that we have the utmost care. This is something which is something where we had some promising results, which in the beginning, a lot of people came up with. They said that before any procedure, you should, if you have a rinse with chlorhexidine or hydrogen peroxide, or so there are various, or alcohol. And alcohol percentage is a bit less than usually what we have. They said because that you can have a decreased bacterial load, which is there, you can also have some effectiveness. But apparently right now, this is still under a lot more research has to be done into this. So we are not sure. So we are still in the threshold of trying to find out more about this. But let's hope that we have a breakthrough. There are a lot of breakthroughs which need to be, we need to get to this so we can know more, so we can try to conquer this in a more efficient way. Some of the materials, in the market which have come about, this is something which is there to, which is a suction, controls moisture and humidity throughout the oral cavity, and improves patient management, safety, and comfort. Has it retracts the tongue and cheek, as seen over here. There are a few companies which have also moved into this. So this is high evacuation units which you have. Again, these are some things which will help as adjuncts, and we need to move and see if as much as we can, even if you have a high volume suction in your clinic, that is something which has to be used along with this with the other suction. So because we need to try to minimize aerosols as much as possible. This is something which now and even Dr. Hussain also spoke about, that we are because of all this pandemic, and we have been locked up, and things have been so it is very stressful, and especially the amount of deaths which we have encountered, it has really brought in. And then at the same time, when you get isolated and you have social distancing, you're removing yourself from all your whatever activities you used to have, traveling which used to be done once upon a time. So all of these things we've curtailed them, and life has changed completely, because this is what we have to do. So it can cause things like, with stress, can slowly move on with that, anxiety taking the best of you, and you can have, so this was something where studies have come about, that now people have were complaining of cracked teeth. And this is something which in the literature I had come across, even TMJ disorders, which you can have headache, neck pain in jaws, dizziness. So all of these things are, and muscle spasms. So it used to be more of things which used to be there. It's becoming more and more common now. It wasn't as common as before, because we are in a situation where so this cracked tooth can be an emergency. And again, then we must make sure that we are taking all these emergencies, and we are making sure that we are that we can ensure that we deal with it. And that is something, again, when it comes to so as stress can be part of it, and it is part of it. It's a very strong word here, which is happening. We need to find coping mechanisms. We need to find some sort of an outlet. So the outlet where I felt that as I was deferring patients before, I felt that I started to um, cycle, and I had used to do that. So I got back to my routine, and I kept building myself more and more, from 20 kilometers to 30 kilometers and beyond. And not beyond 33 was my breaking point, but I could not go beyond. But I felt that this was something where I had to do it because my immunity had to be built up, because I have to practice what I preach. I need to make sure that I'm also building my immunity, and also because I can be ready, because it can affect anybody. And I have been doing that. At the same time, the other coping mechanism which we have is prayers, which is something, again, which is very beautiful in our religion, where we have 5 times where we can have an outlet, and we try to express and remove whatever feelings we have. Uh, and we also have to try to pray that, that we, all our loved ones, stay, uh, away from this. And if God forbid something happens, they get out of it, because, the way it is going. So this is something where, it is something, a time to reflect, trying to bring back whatever life matters. Sometimes we are so caught up in life, and we are so busy, working, and bringing in a lot of patients and things like that. God has been kind, and it has been like that, work has been slowly picking up. But the thing is that you also have to reflect upon this, because we have to stop sometimes, have to realize that, life is very precious, and we need to have this balance, and step away, and also have ourselves that we are in a strong position, that we can conquer this stress, and we do not feel this sort of sadness or anything like that. So this is uh, and we are facing this, because whenever a death happens or anything, so this is something which is even more stressful, and something which we will always have a problem with. But we can always try prayers, and again, an outlet of a workout, or trying to call friends up, things like that, because you can always try to have this conversations with them, just try to, because again, there's this stuff like where violence can also start in, because you're with something. There are stories of that, and today is mental stress day, I believe. So this is something which, unfortunately, and losing jobs, things like that, is happening very frequently. So we have to try to find mechanisms, try to find the positives out of which is not many, unfortunately. So this is where you need to always have an outlet. So this is prayers is always the way which can always try to have some sort of hope, and just move on with that. The other thing, I am a gum specialist. I am a periodontist. So stress also affects the periodontium, and bone loss and everything starts taking place. So this is something which, again, I am having a high uh, amount of patients who are where I'm seeing, and I'm going through that, who have come to me, and they are having this sort of thing, where periodontitis is also on the rise. So this is where I've even tried to do some counseling, and try to bring out that because you have interleukin 1, so some of the pro-inflammatory cytokines which can start causing this. So we need to make sure that we try to de-stress as much as possible, and also try to treat the disease as well. The other thing where I had spoken about be active physically. Uh, and this is very important. Um, Again, this is where a smoker, um, he it is something where they unfortunately are susceptible to corona, and they are the ones who unfortunately can have a very bad episode because it is affecting the lungs, and they have so this is something where this is also coming and giving this also causes periodontal disease, and again we have a rise of that because the people are trying to cope with stress somehow by smoking, and that is a vicious cycle, and it turns into a chain of a lot of unfortunate events. So again, counseling as much as possible, and trying to get them to quit. Smoke cessation is something which I would stress upon. Again, you're trying to save a life that way by trying to uh, educate them, trying to get them out of this habit. And it's very important that you do all this, try to remove all these elements which can make a person feel that they are going to be in trouble. Um, and especially when it comes to a patient with diabetes, and so again, this is also part of periodontology, where a lot of patients who are poor oral hygiene and diabetics, they are the ones who come up and they have a very tough time, and this they have a lot of happening, especially if it's uncontrolled. So what we can do, as if a patient is diabetic, we must make sure that they are not having a sedentary lifestyle. They can try to improve their lifestyle. With that, high blood pressure and all of that, heart disease, all of this, because it makes you prone. When you don't have a sedentary lifestyle, when you try to make it an active lifestyle where you're trying your best to maintain the stress-free life, so maybe you can also combat, if you ever have, God forbid, you can also, while you're keeping yourself fit, you can also keep yourself, your diabetes and blood pressure and all that can also be at bay if you keep yourself fit and healthy. So these are some things which we have to build up our immunity, and then we can make sure that, so again, patients with diabetes, I have been seeing a lot because stress has also been a compounder which has come in. So they are having more of a problem with gum disease. And over here in Pakistan, it is very prevalent, and we don't have so many specialists. So we need to have more of those to also try to fix that gum disease as well. Now, at the same time, what we there, this is something where I believe that which as as we always have information coming in, and some of them are not accurate, some of them are. So right now, these facts over here are to build our immunity: vitamin D, C, zinc. These are things which, we need to go into, make sure that we are having all these things, and because we are trying to, at the end of the day, try to make ourselves stronger so we can combat this issue, and we can make sure that we can get this and try to combat it, because we are trying to combat it. This is part of something which we have to look into and make sure that we are keeping ourselves with our diet. We have to make sure that we're eating healthy, because there was hydrochloroquine, which was also, people thought that that would help. That was ruled out. At the same time, now hydrocortisone, which is now, they're saying, a little bit of a breakthrough. So there is a bit of light at the end of the tunnel where we are getting some breakthroughs where there is a bit of help which can happen for patients with Dexter and all methadone and things like that, which corticosteroids, which can help out. So I am praying and I have my fingers crossed that we are going to try to uh, get this. And I feel that all our scientists are working on it. We just need more prayers and things like that to bring about. So at the end, I just feel that uh, it is, I feel again that prayers has been a very big, important part of my life. And however, whatever I have encountered or done, I've always had prayers which from my loved ones, my parents, and everybody who have brought me to this level. Otherwise, it has always been some. So you have sort of challenges where you have to encounter, you have to go through them, and prayers make you go through that. And so this is a different challenge which has come about now. And we are, hopefully, we just have to make sure that we are well equipped with the proper instrumentation, we have to have the proper equipment to make sure that, as I said about the PPEs, have to be stressed upon the sort of things where you are using the thermometer, you're making sure that you're using the alcohol proper swabs to clean out the areas where you are. These are small things, and a mask, which is again, you can the emphasis cannot be, you have to stress on it as many times as you can, that is very important. So please keep yourself safe, keep your family safe that way. And at the end, again, as I said, I was talking about prayers. So this is something which, again, we need to have a prayer for vaccines. This is where I feel that all of us collectively, and I also, I prayed, and I also, uh, it's a plea for everybody else to start doing this, that we quickly find something so we can get out of this, and we find that we can finally get out of this menace and get back to having a normal life, which has not, the normal is no longer the normal. So let's just pray. And thank you very much, the Impact team, once again. Thank you, Dr. Hussain, Dr. Hira, and all of you have been,
Thank you.
yeah, it's very nice of you to take your time out. And thank you for everything once again.
Thank you, Dr. Asher. It was a very insightful presentation. And now I'd like to start off with the question and answer sessions. I'd request everybody to please mute yourselves. अभी आप mute कर लें सब. You can leave your questions chat box में. You can ask us live on Facebook. And our team will get back to it. We're trying to answer as many questions as we can. आप live भी पूछ सकते हैं. So we're waiting. All you need to do is just introduce yourselves, tell us the name of your institution, and we'd love to start taking the questions now, please. So while we're waiting for the questions to come, there were some very great pointers on both the presenters that they presented in their presentation. एक point था जो Dr. Hussain ने बहुत अच्छा point था कि self-care is very important right now. So self-help or self-care, keeping that in mind, Dr. Hussain, would you tell us how can an individual in this day and age imply that wellness in their life? How can you make that applicable? आपने कहा था wellness is a skill. तो उस चीज को हम कैसे implement कर सकते हैं?
Thank you, Dr. Hira, for this question. I'm quite disappointed in your question because it shows that you have not read my book on skill and wellness.
I shall do that, sir. I shall do that.
Oh, you won't be able to do that because I haven't written it yet.
Chale. Next
So
time,
the
inshallah.
message here is to have little bit of humor. Humor goes a long way, and not to take yourself too seriously. You know, in this day and age, stress is the main, factor which is leading to multiple diseases. Even something like dental caries, now the primary factor is stress. It's not sugar anymore. People say when you have stress, the composition of your saliva changes, and that's how we are having a whole day of chronic stress leads to multiple oral diseases, mental diseases, heart conditions. So yes, taking yourself not too seriously, having some humor in your life, enjoying the good things and being appreciative of stuff, I think is the key to wellness.
Okay. Thank you, sir. Thank you for that answer. कोई और सवाल करना चाहे, you can leave it again in the chat box, और आप अपने आप को unmute करके भी question कर सकते हैं. We did hear some sounds. Anyone who wants to ask a question, you can please unmute yourself and ask the question, or raise your hand, or leave it in the chat box. While we're waiting for questions, another one, Dr. Hussein, if that's okay.
Sure.
Difficult people, if that would be the right word, एक होती है understanding. Obviously, clinician की understanding of COVID would be very different, because ये clinically आप inherit करते हो knowledge, you learn that. और फिर एक layman की understanding of the same disease would be different. So their approach would be different. How would you handle such a situation?
Right. I usually find myself telling people that it is easy to manage a difficult situation, but it's very difficult to manage a difficult person. So you have actually asked me two questions. First one is how to manage a difficult person. So the easy answer to your question is you don't have to manage anything. All you have to do is manage yourself. So when you are faced with a difficult position, a difficult person or a situation, all you have to do is manage yourself well. Know what your values are, know what type of leadership you have, and what is your style. So whether the person is good in your favor or against you, you maintain your integrity. For example, if someone has asked you for something which is completely unacceptable and you lose your temper, so that shows your weakness. But if you manage that person in the same way as you would manage someone who's asked a very reasonable question and who's nice to you, if you manage the same person, that difficult person in the same way, people will first realize that you have integrity, you have patience, and you have the nerves to deal with such situations. Sometimes what happens is that the issue that is being discussed or a matter that has been made into an issue is not the real issue. There is some other issue. Maybe that person is not heard enough. Maybe that person is feeling neglected. So if you are a good listener and you behave in the same way as you behave, which is your normal style, the person will realize, okay, I'm being heard, and then a solution will come up. If a solution cannot come up, just note those points somewhere and say, this is a difficult problem. You've really put me in a spot. Let me think about this. And maybe you can come up with a better solution tomorrow. If you think about it, I will think about it too. Let's work on this problem together. That solves a lot of problems, in my opinion.
Okay, thank you, sir. We have a question from Dr. Mark Uruj. Sir, this is Dr. Hussain. This is directed towards you. Can somebody tell me the name of the book written by Dr. Hussain? Dr. Hussain, आपको book लिखनी पड़ेगी अब तो.
Yes. So as soon as I'm done writing the book, I will send you a copy.
Thank you, sir. We'll wait for it. Another question is, उनका नाम नहीं लिखा हुआ. What will be the main concerns while doing surgery under general anesthetics? This could be taken by Dr. Asher, Dr. Hussain, anyone.
Could you please repeat the question?
The question is, what will be the main concerns while doing surgery under general anesthesia?
Okay, so I'll answer this first, and then I think I would like Dr. Asher to add to it. since the theme is for COVID, I'm assuming that the question is based on infection control.
Yes.
Whether you're doing a simple procedure on your dental unit or if you are going into GA, the principles of cross-infection almost remains the same. The only difference is in GA, it's a more invasive treatment usually. So you have to take extra precautions. Dealing with a COVID patient in GA, there are several protocols out there. It depends what the surgery is, how invasive it is, the time duration it will take. Sometimes we need a negative corona result to go into surgery. Uh, it is also dependent on the practitioner and the hospital setup. I know of surgeons who, for minor surgeries, are not demanding negative COVID results because they say it will take maybe 10,000 or 8,000 rupees, while the surgery is only 2,000 rupees. Uh, Sometimes what happens is that when we have discussions with surgeons, we discuss that the protocol for cross-infection remains the same, whether the patient is positive or negative. We treat every patient as highly infectious, whether the patient has hepatitis or corona or tuberculosis. So we have to make sure we follow the SOPs and the cross-infection guidelines, and then we go ahead with that. I hope that answers the question.
But absolutely. Would you like Dr. Asher to add something to it?
I think that it's very well covered. Dr. Hussain has, I totally concur and I agree. You know, the mask, the 3,000 which I have, you know, all of that, I mean, and added to whatever Dr. Hussain has said, we just have to make ourselves, uh, uh, every patient has to be, we have to make our precautions and we have to be careful about it. So this goes without saying, and it is followed to the letter. And because these are serious times, then this is what we do, and it has to be done that way.
Okay, thank you for that. Dr. Asha, there's a question for you. It's actually quite valid. Pre-appointment screening. Now, how is that possible in a country like Pakistan? This is questions by Dr. Uruj.
It's a good question. So, first of all, we you need to have you need to get once you have the details, because a patient usually calls to have an appointment. So this is where you get your details, and you specifically have to then you it's better instead of the receptionist, since a clinician knows more, because some of the questions can be missed. So it's better to have a proper guidance, first of all, to find out what is the complaint, and to see if it's a minor or a major. So for example, if it is something where you know, where something where there's not much pain, so then we are to this point still trying to defer, until things get a bit more safer. Some procedures we are still going on with precautions, but so you once you've gone through that, you've spoken about that, then having conversation over WhatsApp or Skype or any of those are mediums. Again, as Dr. Zain had also spoken about, that we are now relying a lot upon the technology to bring us forward. If we do not bring technology forward, this is going to be a nasty, so we have to make sure that we have a proper screening that way. And then once we've done that, next is to ask if there's any travel history. And if so again, if you have an internet, you can always use these mediums. They're all free of cost. So an online screening will not take much time, and you can screen it, and you can ask the problem as well. And at the same time, once you've asked that, have you ever had, you have any symptoms of any sort, the patient can answer. So these things can be done, and with this, we are in an era where everybody has WhatsApp, so we can always go ahead and implement it and have a good implementation this way. And it's good that we in Pakistan use a lot of technology, and so since we are using it, we can go ahead and we can screen it very easily.
Thank you for that, Dr. Asher. And I'll just add my 2 cents to it. As Dr. Asher said, pre-screening is being done. Acha, Pakistan, mein I worked, I had the opportunity, alhamdulillah, to work. Various type होते हैं, OPD होता है, फिर हमारा प्राइवेट सेक्टर होता है, तो we've got a huge spectrum. OPD पे if there are people, they don't call in, they walk in to the surgery. Dr. Asher को पता होगा, Dr. Hussein को पता होगा. So when they walk into the surgery, what you can do is आप टेम्पलेट्स बना के रख सकते हो, जो कि आई एम श्योर मोस्टली सब कर रहे होंगे. एक हमारा फॉर्म होता है, प्री फॉर्म, जिसपे मेडिकल हिस्ट्री लेते हैं, जिसपे हम बाकी सवाल पूछते हैं. तो ये जो टेम्पलेट्स होते हैं, अब ऑब्वियसली द वर्ल्ड हैज चेंज्ड बिकॉज ऑफ कोविड, तो उनमें कोविड के सवाल डाल दिए जा सकते हैं कि डू यू हैव एनी फीवर, आपको बुखार रहा है, सिम्टम्स ऑफ लॉस ऑफ टेस्ट एंड स्मेल. तो इन चीज़ों से भी आप शॉर्टलिस्ट कर सकते हो एंड यू कैन समवॉट गेट क्लोजर. ठीक है. दूसरी चीज़ उससे ये होती है कि जब एक शख्स आके ये पढ़ता है, तो उसको पैसिवली अवेयरनेस भी होती है इस बात की कि ये भी सिम्टम हो सकते हैं, जो कि शायद टीवी पे ना दिखाए जाए हों या शायद उसको ना पता चला हो. So that's one thing. And privately, obviously, the reception can hold a template as well of all these questions in the clinics. So we're all learning from each other. If there are any other pointers anyone would like to add to it, we would love to learn. If you would want to share it later on the impact page, we are all members. I'd also recommend कि आप लोग भी जाके like करें please page को, tell your friends, because I think this is a great platform for all of us to learn from. And now since everything has become digital, I presume you would all be staying online much more, obviously within controlled means. और कोई सवाल, any questions, किसी को live पूछना है अभी, please unmute yourselves, introduce yourself, नाम बताएं, institution का नाम बताएं, और प्लीज सवाल कर सकते हैं आप लोग. Let's have a look. It's fine. We'll wait for questions in the chat box. Meanwhile, Dr. Asher, you are also a head of department of periodontology, or you did mention in your presentation aerosol-based procedures, which is a dilemma all over the world. I think dentists would be suffering more. यहाँ पे भी यही प्रॉब्लम है, वर्ल्ड वाइड प्रॉब्लम बन गई है. तो हाउ डू यू मैनेज दिस सिचुएशन? Scaling, currently hand scaling and ultrasonic both have good results. Now it's considered both give you good results, but in certain circumstances, everybody or someone would prefer ultrasonic scaling. Ab is pe, what would you like to tell us about this, these times?
So now the protocols and everything. So what we have come about is that these procedures, especially with an ultrasonic, you can have aerosols, and this can have the sort of effects which we do not want. So ultimately, in the beginning, it was all about Gracie curettes. That's how we started off in Padmajana, and even while I'm doing it, because as I said, there are some things which when I was being trained in the UK, I found that most of my work was being done, and I was using that, and this is something which I have become very dexterous with time, and I can even manage the most toughest of things with that. And I feel that your your whatever work you've done is still incomplete if you do not use those. And I feel that now it has come more in vogue now. It has come because everybody has this dilemma. This problem is not going away. So we are using that now. And I believe that that's how we started off in the department. And that is how we are moving forward. And when time comes, we will start using the ultrasonic as well. And it is coming soon as we are monitoring. Again, media and all of this has a big part, and we monitor those. when things start getting less, then we start moving forward that way. And if you have the proper protection, then you can carry on and do whatever work you have. So the pictures I showed, the kind of masks I'm using, so we are well equipped. And so this is something which we have to be, for to move forward, because otherwise we are going to be left behind. So we have to keep on making sure that as time passes, we are getting more and more knowledge, and more we gather more, and we are trying to get more and more safety in dentistry. And it is an evolving process. And let's just hope that we still don't slip up, and make sure that we are very stringent and very strict on these, because the moment again, as I said, people have stopped wearing masks and things like that. So this is something which we cannot slip up right now. These are very crucial times, so everybody has to play their part.
Thank you so much, Dr. Asher. Dr. Uruj has requested, I request there should be once in a week dentistry lecture if possible for the impact team. The impact team is, I'm sure, reading this. We're part of the impact team. Uruj, thank you for your question. We'll try our best. No promises as yet, but inshallah, koshish jari hai. And to keeping the note alive, the world is changing. Things are changing, as Dr. Asher said, so we all have to adapt to it. Dr. Hussein ने बहुत अच्छा point दिया था, self help बहुत ज़रूरी है. We need to take care of ourselves. Once we take care of ourselves, we'll be able to take care of other people much better. We have the necessary skills, and we have to keep on reassuring everyone. Like in life, हर बंदा हर चीज़ से उस तरीके से अडेप्ट नहीं करता, या शायद उतने अच्छे तरीके से अडेप्ट नहीं कर पाता जिस तरीके से शायद आप कर पाते हो. तो प्लीज़ सपोर्ट ईच अदर, बी काइंड टू एवरीवन, help each other in whatever capacity that you can. And on this note, we've come to an end. I'd like to thank the impact team, the organization, for this wonderful opportunity. Please do go and like the Facebook page, the impact page, spread the word, share the page, let your friends know about it. The best way to learn is by helping each other, sharing knowledge, and that's the way to go forward. I would like to thank our wonderful speakers, Dr. Hussein Askari, Dr. Asher Jamil. Thank you for taking time out and enlightening us with your knowledge on the presentation topics and answering each and every question to perfection. Thank you very much. I would like to thank Health Department, Government of Sindh, Yarane Watan, for their constant support and encouragement. They've tremendously supported impact throughout all the sessions that have been conducted. Thank you very much. I'd like to thank Vice Chancellor, Dean of Medical Universities who've joined in, all the participants who've joined in, who've asked questions, who are on Facebook. Thank you very, very much. We would encourage you again to like the Facebook page, and also the impact would leave a feedback form. That's the way we learn, that's the way we move forward. So please अपना feedback ज़रूर छोड़िएगा उस page पे. And if you have any questions that come to you later on, please leave them on the Facebook page. Thank you very much. Thank you to all the institutions who've joined in. Take care of yourselves, and Allah Hafiz. Khuda Hafiz.
Allah Hafiz.
Allah Hafiz.